Hi, everybody. This is Dr. Oji from MP Skills Made Easy Workshops, and you're listening to the Prescriber Essentials Podcast, the show that helps you delve into the world of clinical skills and knowledge for clinicians who love to continually improve their clinical skills. I discuss content to help you grow professionally and the opportunities and strategies to provide excellent care like a pro. All right, so in 2021, what had happened was that, the CMS, so again, we always talk about Medicare, had requested for, changes to be made so that providers can hopefully, start enjoying easier documentation on the evaluation and management system. There is a permanent telehealth coverage, so telehealth is really not going anywhere. There are increases in telemonitoring coverage, and then new prolonged services code. So we're going to talk about those in a little more detail. So with your telemonitoring coverage, and I'm sure maybe most of you know about it, so remote telemonitoring is really where we're able to see patients. So let's say you have a Medicare patient, and then you're able to have this patient go home with a glucometer. Maybe the patient is diabetic, or if a patient is, let's say, hypertensive, they have a blood pressure monitoring machine that they can take home. But essentially what happens is that this patient's data gets electronically sent to your practice, okay? So you're able to see the patient's glucose, blood sugar readings. You're able to see their blood pressure. They have a scale. If the patient is, let's say, a CHF patient, heart failure patient, they're able to get a scale sent to their home. And so you can monitor their weights. You can monitor some vital signs that would really help you. And even the blood sugar that can help you to manage this patient's condition much better. So let's give an example. So let's say a patient comes in, and this is a diabetic patient, and they go home with a glucometer. So again, you have to get some type of service. So it has to be either an LVN or an RN going to this patient's homes to collect the data, or there's some companies that now have, they have this data electronically sent to your practice. So you're able to see this patient's A1C, but also their blood glucose, readings, and you're able to make changes based on those readings. So the patient doesn't have to physically be there. And we did have a nurse practitioner that was in one of our workshops, and she owned her own practice, and she had said that just because of introducing the telemonitoring coverage in her practice, she was able to get reimbursed up to $100K extra by Medicare by introducing this to her practice. So again, something that you want to consider in your practice for the future. Okay. All right. So let's talk a little bit about your coding. So in 2021, there's some guidelines that changed. So before I start, I just want to make sure that you are aware that a new patient that comes in, you're billing them an O. So an O means new, and a 1 means established. So 99201 was deleted in 2021. So now we start from 99202. So O again means when I say O is 0. So 99202 is actually a new patient. And then of course it goes down in order of severity from 202 to 205. And then your established patients will be 99211 up to 99215. Okay. So this would be in your outpatient setting. So in the inpatient setting is still status quo. Nothing has changed. They're still using the 95 to 97 guidelines. So you can kind of see that that would be for the inpatient visits, for initial observation care, for your nursing home visits, and all of those critical care. They're still using the CMS 95, 97 guideline. And in the outpatient setting, now we're using the 2021 guideline. Okay, so let's talk a little bit about the changes that occurred in 2021, okay? The main changes that occurred is really MDM, so the medical decision making and time. So we used to be that we would count our the elements of a review of system and the physical exam. But based on those elements, we're able to code whether this patient is a 99212, 213, 214, 215. But now we use MDM, which is medical decision making, or time. Okay. And then we kind of talked about the new reduced prolonged services code. So you're going to see that there is an increase in RVUs. And then, of course, CMS is really hoping that, providers are patient care centric with less paperwork. Okay. I'm not sure about how that is going. But again, just something that, these are the changes that they're hoping to, get for every provider to be able to go home with less paperwork. And then now we're counting all the time. So if you decide that, okay, well, I'm not going to use MDM, but I'm going to use time to charge or to bill for my service, then you want to count all the time. So we'll count the pre and the post, and we'll talk about that in more detail in the next few slides. So the whole point is really to save 180 hours a year per provider on notes. So again, something that you want to keep in mind. Okay, so when we talk about the medical decision making, so it's either medical decision making or time, so whichever is greater, medical necessity is still key and must be documented. So I just want to put a plug here as a new provider. You know that your in-laws know that you're now a new provider. Your neighbor knows that you're a provider, and you would be tempted to, you get those requests, the, offhand request that, okay, you please send amoxicillin to the pharmacy because my son is, sick and, I can't get into the urgent care. Be real careful with those type of requests. And I would just suggest that, you have a ready-made answer before you even get those requests, and always try to redirect this patients to a clinic, even if it's your clinic, but the patient needs to establish with a provider before, getting the prescriptions. And if you do that for too long, and then the pharmacist will start noticing, the insurance companies will start noticing. So you really don't want to do that at all if it's possible. Excuse me. So again, MDM or time, whichever is greater, medical necessity is still key and must be documented. So always think about that. So we'll go into a little more detail about what medical decision making means. Okay. So the new guidelines for 2021, you can kind of see the code, the levels, the problems, the data analysis, and the risk. So the code for 99202 would be a straightforward problem with minimal complexity. The data analyzed will be minimal or none. The risk is very minimal. So that would be your straightforward patient comes in with, maybe a sore throat. You're really not doing much with it because, okay, well, it might not be strep. It could just be, or just COVID or, the flu, but you're not really doing much with that. But we do so much more. So if a patient comes in with, COVID or strep or flu, and you have to run the tests, then you have to start thinking about billing a 99203. So remember, 03 is a new patient, okay? So the level is low for 99203. The problem is low. Data analysis is limited, and the risk is low, okay? So again, that would be a straightforward, low complexity, low levels, low problems. So again, an example would be a COVID. Maybe the patient has COVID, but also has acute pharyngitis or strep pharyngitis, and you want to treat those. That would be your low level 99203 patients. 99204 would be more moderate level. Data analysis is moderate. Risk is moderate. 99205 high. Problem is high. Data analysis is more extensive, and the risk is high. So again, we're going to go into a lot more detail with all of this, but this really tells you exactly the number and the complexity of the problems addressed at each encounter. And only the actively treated diagnoses are credited to the level of service. So you do not want to think about a service that you provided maybe last week and use that as the service for today. And then the amount and complexity of data to be reviewed and analyzed should be included, and the risk of complications and morbidity. So again, when you're billing a 99205, there has to be a high level of risk of complications, morbidity, or mortality. If you like what you hear on the show, then be sure to check out our Prescriber Essentials Academy, which is a continuing education platform where we delve deeper. Visit schools.mpskillsmadeeasy.com to join us. See you on the other side.